Okay. Well, we'll move along, and then we will definitely be available to answer questions. So, signs and symptoms of diabetes. Now, some of these symptoms can be very generic. If you look at the list here, frequent urination, that sounds like me. Excessive thirst, I'm always thirsty. Nighttime urination, extreme hunger, weight gain, fatigue, blurry vision. Those are some of your more common signs and symptoms of diabetes. Also on this list, and I inherited this presentation from American Diabetes Association, but they're listed here, acanthus nigricans, which is a dark skin around the neck or armpit. There are little asterisks right there because this is not necessarily a sign of diabetes, but especially in the African American population, you may see this. So, does this look familiar to anyone?
Yeah.
Have you seen anyone with this? So, it's just shared today because it might be a sign that someone may have diabetes, but there are other reasons for this, okay? But I personally do know several people who have this and are diabetic. So just something to look at. Alrighty. Now, complications of diabetes. Now, obviously we want to prevent getting diabetes. And if you have diabetes, it's very, very important that you manage it for several reasons. There are several complications that can happen with diabetes, and we want to ward some of these things off. Heart disease, stroke, having amputations. Amputations are when you have to surgically remove either a limb, and it's usually due to poor circulation. Eye problems. You might hear this called as retinopathy. When you have high glucose levels, high blood sugar levels, having that high glucose level can be damaging to the very small vessels of your eye, which lead to the blurred vision and lead to the blindness. Same with your kidneys. Having that high blood sugar level can be damaging to the arteries in your kidneys, and it can lead to nephropathy, as well as nerve problems. This is where you hear people like I have some numbness and tingling in my feet. This is neuropathy, and it can happen with diabetes. So we often tell people who have diabetes to please check your feet, do a visual check, because sometimes with, and I've seen this, I've worked in the hospital, I've seen patients with this, and which has led to amputation if not taken care of. When diabetic patients come in and they have neuropathy, it's very important that they visually do an inspection of their feet, because the smallest little nick or cut can turn into an infection, which can lead to something else and eventually end up into an amputation. So it's something serious, and you definitely want to keep an eye out for that. Okay. Now, the American Diabetes Association has what they call their ABCs of diabetes care. And this is something that I wanted to introduce because it's something very basic and something easy to learn and walk away with. So ABCs. A, A1C. Have you all heard of the hemoglobin A1C?
Yep.
Yes? What is it, sir?
As of last week, 6.8.
6.8, that's great. But can you tell our crowd what is a hemoglobin A1C? Hold on. I told you I was going to be interactive.
Well, that actually, if it's in the high areas, let's say 10s or above or 8s, even maybe 7 and above, it really does damage to your eyes, kidneys, basically making you go blind or having to go to dialysis. So when you can actually lower that number, it's actually better for you from controlling that losing of vision or loss of kidney use.
Thank you for sharing that, sir. So hemoglobin A1C is basically a blood test that gives you an average of what your blood glucose level has been for the past 2 or 3 months. Okay, so the recommended level is less than 7, and you should have it checked at least 4 times a year if you're diabetic. Okay? Also, B for blood pressure. Definitely want to manage your blood pressure. So already being diabetic or having high blood sugar levels puts you at a risk for heart disease. Okay? So you definitely want to manage your blood pressure because blood pressure also contributes to that heart disease. So the recommendation from the American Diabetes Association is if you're diabetic, you definitely want to keep your blood pressure 130/80 or below. Okay, that is a goal. And C, cholesterol. Your cholesterol numbers tell you about the amount of fat in your blood. This is important to know. Your cholesterol levels, along with being diabetic, can, again, increase your risk factors for having a heart disease or stroke. So there are some numbers here referring to your cholesterol. HDL. Do you all know what HDL is? HDL. Is that your good cholesterol or your bad cholesterol? It's your good cholesterol, HDL. Okay, so in men, recommended that it is 40 and above, and for women, 50 and above. LDL is your bad cholesterol, so you want that below 100. And then your triglycerides, you want that below 150. So these are just the ABCs of diabetic care. Again, because having diabetes puts you at a higher risk for having a heart attack and a stroke and things of that nature. So it's very, very important that you manage your blood sugar, your glucose levels. Okay, in addition to those things, other things that you can do to help manage your diabetes: eat a well-balanced and nutritious meal, maintain a healthy weight. So even losing a couple pounds can make a real big difference in your blood glucose level. It really can. It can also make a difference in your blood pressure as well. Exercise regularly. Who can tell me what the recommended amount of exercise is? Yes, ma'am.
30 hours a week.
30 hours a week?
No, I'm sorry, 3 hours.
Okay, so 30.
6 days, 30 minutes.
She says 6 days, 30 minutes. That's good. It's actually, well, moderate exercise 5 days a week, 30 minutes a day at least. But that's good. If you want to exercise 6 days, go ahead. I'm not mad at you. Okay, but you want to exercise regularly. This actually helps the body utilize the glucose level, the sugar that's in your body. And it has other great effects as well, lowering your blood pressure and things like that. You also want to take your medication as prescribed. I know several people who are on medications and they try to wean themselves down. I don't know if any of y'all have heard of that or know of anyone, or you may do it yourself. They'll say, oh, you know, I'm on my diabetic medication, but my sugar was good yesterday. I don't need to take it. I'm just going to take half a pill today, or I'm just going to skip it today. You need to take your medication as prescribed and communicate those changes with your physicians. If you feel like your sugar is better and you don't need the medication, you need to talk to your healthcare provider. And you want to participate in routine medical screening. So get your annual physicals done. Get your eyes checked. You need to get those dilated. We want to take a look at those vessels in your eyes. You want to get your feet checked. Definitely want to do that. And there's also some urine tests and some other things to check the function of your kidneys, especially if you are diabetic. So these are very, very important things that you need to do. Let's see here. And then if you have more, for more information, you can always contact the American Diabetes Association. They have tons of information. Please visit the website. There's tons of information there. And as you go around to these booths, there are several pamphlets. Just pick one. Pick one that you like. Put a magnet, put it on top of your refrigerator, leave one in the bathroom and one in your nightstand. Because those are 3 places I know that you're going to go. You're going to go to bed, you're going to go to the bathroom, and you're going to go to your refrigerator. So you need to have important information like this in those places. Okay, so any questions so far? This was Diabetes Basic 101. Do you all feel like you have a better understanding of what diabetes is? Yeah. Okay, I need one brave soul to volunteer for my questions, and I'll have a prize for you if you get all the questions right. Anyone want to volunteer? Nay Nay, you gonna volunteer? Come on, y'all. Nay Nay's gonna do it. Come on. Okay, Nay Nay. Okay, Nay Nay, please explain to me, what is diabetes?
Diabetes is when your blood glucose, also known as blood sugar, is not high enough. Or is too high.
Please name the 3 most common types of diabetes.
There is type 1, type 2, and just stationary.
Just stationary. She only 10, y'all. She only 10. It's all right. Okay. Please give me 2 complications of diabetes. What can happen if you don't manage your blood sugar properly?
You could have a heart attack or a stroke.
Now, please tell me 3 things that I can do to either prevent diabetes or manage my diabetes. She's good, y'all.
Eat healthy, exercise every day, and have a healthy eating habit. Make sure you eat a lot of healthy food.
I think she did great, y'all. What do you think?
Yeah.
Okay. Well, I do have a prize for Nay Nay. Even though I don't think Nay Nay is the person in the kitchen, I'm gonna come around here and grab something. So, is that your mom? Oh, okay. Wait, hold on. I'm gonna come back here. Y'all gonna see me in a minute. But and some of y'all gonna be mad that you didn't participate, but that's okay. Nay Nay gets the book, gets the prize. So what I have for Nay Nay is a new soul food cookbook for diabetics. You should have stood up and answered the question. I know. Okay, so I want to thank everyone for listening. Again, this was a Basics Diabetes 101. I hope it helped you. Again, it's a chronic disease. It's very complicated, but it's really important that we have a basic understanding of what it is so we know what questions to ask. We know why the physician is providing a certain medication, why exercise is important, and why you might be having some of the signs and symptoms that you have. Alrighty? Thank you very much. My name is Nurse Alice. If you have any questions, I'll be here to the side.
All right.